Hey friends, it's that time of year again, and nope, not pumpkin spice season. Though, if you're into that, no judgment. I'm talking about open enrollment, that special time when we get to take a good hard look at our health insurance and make sure we're covered for the year ahead. Now, I get it. Most folks would rather try pumpkin spice deodorant than talk about health insurance. But hang in with me for a few minutes because there are some big changes coming in 2025 you'll definitely want to know about. You see, our economy's been through a lot, and the health insurance world's been right there in the middle of it. Costs are rising again, and premiums are feeling it. So here's what's going on. Prescription drugs continue to be one of the fastest growing expenses. Inflation, though cooling down, is still adding pressure, and mental health care, chronic conditions, and a shortage of health workers are all driving costs up. And like we learned back in Econ 101, when costs go up, prices are sure to follow. So for 2025, marketplace insurers are already asking for a 7% increase in premiums. If you get coverage through your job, expect an average of 5.8% bump in total health benefit costs. That's 3 years in a row of 5% plus increases. Now, the biggest reason costs keep climbing are specialty drugs and new treatments. We're seeing huge advances in medicine, especially in gene therapy. But those treatments can cost hundreds of thousands, sometimes millions. And while new treatments bring hope, they also bring higher price tags. Now, at the same time, health conditions like obesity, prediabetes, and cancer in younger adults are becoming more common. These are now major cost drivers for employers and insurers alike. But there's some good news too. The healthcare system is slowly shifting toward what's called value-based care, meaning doctors and hospitals get paid based on how well they help patients recover, not how many procedures they perform. The idea is to encourage better care, fewer unnecessary tests, and lower costs long term. Okay, no flying cars yet, but technology is definitely changing health insurance. Now, telehealth, which took off during the pandemic, is here to stay. Virtual visits and remote monitoring let patients check in from home, and in many cases, that can prevent expensive hospital stays. Then there's AI and machine learning. That's huge because insurance companies are using it to speed up claims, detect fraud, and personalize plan pricing. Doctors are using it to schedule appointments, interpret tests, even help diagnose disease. One company is training AI to detect skin cancer early, which could literally save lives. Bottom line, the robots aren't taking over. They're just making healthcare faster, more efficient, and more data driven. You see, people are more open to using AI in healthcare, especially younger folks. We've also seen a big shift toward mental and behavioral health since COVID. The demand for those services is high, but there's a shortage of providers, which means costs keep rising. Now, here's something that surprised me. 65% of people don't see a doctor until something is urgent. That's like waiting till your car engine blows before changing the oil. Preventative care, annual checkups, screening, nutrition cost a lot less than emergency care. Now, so expect insurance companies to start offering more incentives for staying proactive about your health. So let's talk about what's changing on the government side. Now, a few key laws are shaping things right now. The No Surprise Act protects you from unexpected bills if you accidentally get treated by an out-of-network provider. See, the Inflation Reduction Act is aimed at lowering prescription drug costs, but in the short term, it's actually driving up some prices as manufacturers adjust. Now, our updates for 2025, the cap on how much your household income can be towards employer health insurance is rising from 8.39% to 9.02%. Medicare Part D premiums are expected to dip slightly, and Medicare is expanding special enrollment periods to give people more flexibility. There's also been a big push to make mental health coverage more equal to physical health coverage. That means insurance plans will need to make it easier for people to access counseling, therapy, and other services. Now let's talk strategy. See, health insurance costs may be going up, but you're not powerless. The smartest move you can make, Work with an independent insurance agent. They don't represent one company, they shop around for you. They'll compare plans, look at your situation, and find the coverage that actually fits your family and your budget. And remember, whether it's through your employer or the marketplace, you need to understand what you're paying for and why. That's how you stay in control of your money and not the other way around. Now, healthcare costs are rising, technology is evolving, and government prices keep shifting. But here's what doesn't change. You are the one in charge of your financial future. So take time this open enrollment season to make smart, informed decisions. Know your options, shop around, and protect your health and your wallet in 2025.